Good morning. I'm Amy Smaller, Senior Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. I'd like to welcome you to today's Executive Insight Series session. We're thrilled to be continuing this series in 2025, and we've hosted over a dozen interviews with healthcare leaders on the most important topics facing Commonwealth patients and caregivers. A few logistics before we start. We will be recording the session for those who aren't able to join us today, and we will be in listen-only mode. If you have any questions, please place them in the chat feature, and we will do our best to get them addressed during our time together today. I want to take a moment to thank our 2025 annual sponsors, as well as our strategic partners for their support in underwriting MHA's education programs. In particular, I would like to thank today's program sponsor, Robinson & Cole. Robinson & Cole is a full-service AM Law 200 firm with a vibrant healthcare practice. They serve healthcare clients throughout Massachusetts as well as nationally. They're experienced lawyers trained to help clients meet their needs and business objectives within complicated legal and regulatory frameworks. They're a valued partner in fulfilling MHA's mission. I will now hand it over to Kate Healy, partner at Robinson & Cole, to say a few words.
Good morning, everyone. Thank you, Amy, and thank you to the MHA. Robinson & Cole is pleased to sponsor the MHA's Executive Leadership Series and to speak this morning to Peter Banko, the President and CEO of Baystate Health. I learned this morning that Peter is a fellow college football enthusiast, and now that we've talked football, I'm looking forward to hearing him talk about advancing healthcare. I'd also like to thank and introduce Steve Walsh, the CEO of the Mass Hospital Association, who does such a fantastic job pulling these events together. Steve, I'll turn it over to you.
Thank you, Kate, and thanks once again for being a great partner with us and our members here at MHA, and thanks, Amy, for another great event and extraordinary education programming throughout the year. I hope all of your new year is off to a great start. We are excited to be back together for our first Executive Insights episode of 2025. We'll start by saying what we say all the time. Massachusetts has arguably the finest healthcare system in the world, but it moves at warp speed, and we really get to pause and learn from some of our leaders who help make our successes possible. And that's what these sessions are all about, getting to know some of the brightest minds in our sector. We get to learn from their experiences, we get to hear about their vision, and we are reminded of the common thread between each of us working in healthcare, a deep desire to change lives of patients and improve the communities that we serve. And that brings us to today's guest. Peter Banko is the President and CEO of Baystate Health, a position he has held since June of last year. Baystate is part of the Western Massachusetts identity. It serves more than 800,000 patients with a full range of medical needs, employs over 13,000 people, and is constantly at the forefront of innovation and community outreach. Peter has a long track record of leading healthcare transformation and innovation in large systems across the country. Prior to joining Baystate, Peter served as President and CEO of Centura Health in Colorado, a part of the National Common Spirit Health System, and he spent nearly 20 years in senior leadership roles at Common Spirit, including as its Southeast Operations VP and its National Chief Integration Officer. So Peter has seen all sorts of different changes, ideas, and what has worked and what hasn't throughout the entire country. Now Peter's back close to home in the Northeast. He's a New Jersey native. He is a University of Notre Dame alum, and he earned his Master's of Health Administration at Cornell University. Peter, thanks so much for joining us today. It's a great opportunity to spend a little time with you. And to kick us off, I feel like I have to follow up on Kate's question. You know, some might describe Baystate as a bit of an underdog. And you're here to try to make sure that you can get to the championship. Well, your school that you love so much, Notre Dame, is there next Monday. Marcus Freeman has done an incredible turnaround of the Notre Dame football program. Do they have a shot against Ohio State?
Yeah, I'm feeling good. I absolutely do. It feels like destiny. Yeah, I'm a season ticket holder. I'm not going on Monday night because my senior year was our last national championship was a long time ago. And so I've been disappointed for 35 years. So I booked a senior team retreat the day of the championship. So I'm paying for my 4 kids to go. One's Notre Dame grad, one's there now doing his master's. So everybody else will get to enjoy. I feel good. I feel good.
Well, good. Well, good luck on Monday night, and we'll all be rooting for the underdog. Once again, it's a great story. Now, I know your first exposure to healthcare came during your college years. Can you tell a little bit about what was that experience and what ended up kind of exciting and driving you into the field?
It actually started in high school. I went to an all boys Catholic high school, and somebody a year ahead of me said, "Hey, there's candy stripers at the local hospital," and so I started volunteering on weekends and during the summer. I never got a date out of it. I mean, look at this now, and then imagine what a mess I was in high school. So I started volunteering, but the CEO of the hospital was a nun. She was maybe 5'1", 5'2". She loved Notre Dame football, so it took me under her wing. And so I was a patient transporter, a radiology file clerk, and I was down a different path at Notre Dame. I was an aerospace engineering major. In the middle of my junior year, I was working as a transporter during Christmas break to make some extra money. And I had failed 2 classes that semester. So mechanics of solids and thermodynamics, both of which apply in healthcare management every day. So I missed failing those classes. But she's like, "You don't look so good," in the hallway. And I was like, "Yeah, I failed 2 classes. I think they're going to kick me out of the school." She's like, "No, they're not." So I mean, imagine a CEO of a 400 plus bed major teaching hospital. She called me in her office. I think we were in there for 3 or 4 hours. And she's like, "You got a call tomorrow with the dean of engineering." And I was in ROTC, the colonel in charge of ROTC and your parents. And she's like, "Here's the plan." And the first thing she said was, "The plan all revolves around, I've been watching you, and I think you have an aptitude for healthcare leadership." And then so she mapped out a plan. And then I get on this call and I articulated the plan she and I came up with. And the dean of engineering said, "You're going to transfer to the business school. And if I never want to see you in the College of Engineering ever again." So about 20 years later, I had to go to the bathroom, and the only closest bathroom was in the College of Engineering. And I felt very guilty, but I went to the bathroom, but I ran in and ran out. So the rest is history.
You know, it's funny. We often talk to our leaders about their mentees and who were their mentors, and it sounds like you found one early that really shaped your path.
Yeah, so like that summer, 6 months later, she got diagnosed with terminal cancer, and she was an icon. The hospital is in New Brunswick, New Jersey. She's like, we had no money to pay for pens and pencils. She's like, I had to take money out of my pocket on some of the times just to pay bills. Um, and so she didn't want employees to know she was dying. So I was her personal kind of valet and transporter. So would bring her in the back door for care, kind of walk her through the hallways where no one would see. And she passed away a couple months later. So it was a full circle moment where she helped me and I was able to help her at the end of her life.
Pretty that's a great story. Yeah, thanks for sharing that. And certainly sounds like it shaped you. So we go from two Fs, 2 failing classes, to leading one of the largest healthcare networks in the country.
Yeah,
What sort of
there is hope.
mindset? Yeah, right. But they say in healthcare, sometimes hope is not a strategy. So clearly
Right.
you learned some things along the way. What kind of mindset and leadership traits do you attribute to some of the success that led to your career journey?
Yeah, I never thought both my parents were elementary school teachers, so the CEO was an absolutely foreign concept to me. Like even I remember high school classmates like, "I'm gonna go get an MBA." I'm like, "I don't even know what that is," right? So there were no CEOs in the family, no executives. But my father, they were both elementary school teachers. My father was a coach, so um, got a little bit of that coaching mentality of you got to want to win. You never give up. You never let up, and you're never satisfied. Like good isn't good enough. So I would say those have driven me. The analogy I use is I kind of view myself like King Arthur. Um, so you pull. I didn't aspire to do this. You pull the sword out of the stone, and now you're the boss. And really, if you think about it, Merlin should have been. I mean, Merlin the magician should have been the CEO, right? But Merlin like went away when things were bad, kind of popped in, did some magic and left, which we all have had colleagues that kind of pop in, do some stuff and then leave again, and then we never see them. Um, So King Arthur had to go through the grind. So that's the best analogy I can use kind of landing here is I pulled the sword out of the stone and now you got to make the best of it.
Yeah, now you're holding the sword. I used to have a colleague that when things got tough, he would say, "Do you think I'm David Copperfield?" So we are somewhat, as you probably have figured out, and certainly coming from New Jersey, a little bit parochial here in Massachusetts. So we think that there's only one Springfield in the country, but most people around the country wouldn't even think of Massachusetts if they heard Springfield. So how did you hear about the Baystate job?
Oh,
Kind of
yeah.
attracted you to the role.
Yeah, it was last fall. I was in line for the bathroom at the Notre Dame USC game, literally. And there was two people in front of me that I know, Notre Dame grad, has done a lot of search work here in the past. He was with Phillips to Pisa, which is, kind of a
Yeah.
solid Massachusetts firm. And he turns around, he goes, "Hey, would you entertain an opportunity?" And it was at a point where I was entertaining opportunities. And he's like, "Baystate." And I'm like, "Do you mean like Baycare in Florida?" He goes, "No, Springfield, Mass." And I knew Springfield, Mass. My dad was a basketball coach, loved the Basketball Hall of Fame. So we couldn't afford to do many vacations. But I think as a kid, I probably had been to the Basketball Hall of Fame like 3 or 4 times. So he's like, "Go look at it." So Sunday, after it was a night game, after the game, I start doing research. I was like, "Oh, this looks intriguing." I called a search firm and they're like, "We're kind of late. We're presenting resumes," but they knew who I was. So they presented my resume and the rest is history, right? Only the fourth CEO in the company's history, the first from outside the organization, which, for folks on the call, I always like to say, if you're the internal candidate for a job, but the board or leadership want change, you got no shot at it. So it was a signal from the board and others that they wanted transformation and change, and here I am.
So you look at this role and you come into Massachusetts, and you have any first impressions? How does the system work? I mean, certainly you've seen the healthcare world from all different points around the country. How are we different here? And are there things that you're learning from Massachusetts or that you're teaching Massachusetts that you've learned along the way?
So I say this behind your back, and I'll say it to your face. We're blessed to have you in MHA, and unless you've worked other places, like I've not had a really solid hospital association in over 2 decades. So we're truly blessed, and how the systems here work together and are collegial around the right issues, that doesn't happen everywhere. So, while you compete viciously in other states, they compete viciously on policy and try to get yourself exempted and promote things that are for your system. So I think we're uniquely blessed here that we're together as healthcare systems and that we've got you and MHA leading us. A lot of the challenges, workforce is a challenge everywhere. That's a common theme. So I'd say most of the problems are the same. Revenue's not growing as fast as expenses, contract labor, recruitment, retention, behavioral health access, all those are common issues. I would say what's unique to here, Massachusetts, New England, Northeast, is the aging population. So in Denver, we had 50 new people moving into Denver every day. So you could literally, as a healthcare system, sit still and grow. And so housing was expanding. So as we're doing our strategic plan, you look at over the next 5 to 10 years in Western Mass, our population isn't growing, right? So the pie is staying the same, particularly from an inpatient end. Now, outpatient, there's some growth opportunities. For us here, 72% Medicare, Medicaid, so huge government pay. So value-based care plays a greater role here. And how do we do that for those populations? Out west, people couldn't spell HMO, right? Or value-based care. So every health plan was making a lot of money. Every health system, we had double-digit EBITDAs there, right? And so a bad year was like 13% EBITDA. So everybody was flush with cash, building stuff all over the place. When I was there, we built a brand new hospital. We acquired 7 hospitals. So a lot of money to do a lot of things. And here it's a lot tighter. It feels like growing up with two elementary school parents, not a lot of money to do things. So access, big issue. That's a big issue across the country. My view is if a system can solve access issues, you're going to win in your market. And then that whole value-based care. So we're spending a lot of time as a system right now in our strategic plan, separating as a financing model from care model. So we often confuse when we say value-based care, conflate the two. So how are we delivering care to a certain population, and then what's the financing model for it? So I would say we started a strategic planning process in October, and that's been every bit the conversation the last couple of months, is how to figure that out.
Yeah, you bring up a lot of great points about where we're going. And first and foremost, thanks for the kind words, but it's really our board, and you've hit the nail on the head. Our leaders here, and you're now part of it, are really incredible collaborators, and they lean in. They have fiduciary responsibilities to organizations, but they know when there's a common goal and a greater good. So you got the job by standing in line, which I think is a good lesson to all of our young leaders, right? Like use a line as an opportunity, not something that's a pain. And see where it goes, and meet new people. So now here you are, and you've got a bold turnaround plan for the system. So you're leading an improvement plan. You've talked about how difficult it is to eke out a margin in Massachusetts. What are some of the core goals that you've identified for Baystate now 6 months into the job? And how do you reach them? How do you kind of move that system? Because we know how important it is to the whole Western Mass population.
Well, first is you have to have a vision. So the light at the end of the tunnel can't be a train coming at our 13,000 people. So we're getting a lot of people involved in a strategic plan. We're shifting our operating model to being more clinically driven, physician led. So too many organizations are finance driven. So, hey, we can't do that because of the budget, or operationally driven. So we're trying to we've got a blessing here, being part of UMass Medical School, our faculty. We're blessed with a lot of the best medical staff and physician network I've ever had. We really invested in the 80s and 90s in primary care. When other systems got out of it, we stayed with it. I think we have one of the first PHOs, CINs formed in 1989, still existing. So we've got really nice physician integration, physician leadership. So being able to leverage that, understanding we're the economic and health pillar in Western Massachusetts. So if we don't do it, there are very few other options too. So there's services that we provide that, if we were a for-profit or a private equity, we wouldn't be in that business, but it's core to who we are. That's what really attracted me here, was the board. The board and physicians and team members are really hyper-focused in on mission and community. And that's why I got into doing this in the 1980s. And sometimes another life lesson is you lose sight of why are you doing this healthcare management stuff? And Baystate's gotten me back to that. Making sure we're a right destination to work and practice, and then the long-term financial resilience. So we've had a tough couple of years. We've lost $300 million of cash, right? So our days cash have gone down from, in our heyday of the early 2000s, of 200 plus, we're down to 109. So we've got to do some things and create, when you come in, you try to say, is there a path forward? And there is, but it's 225 million of kind of rolling up your sleeves, gritty operational discipline. In Colorado, you could sit with your feet up and eat bonbons and do very well. In Massachusetts, you've got to be operationally disciplined. So we're looking at, from a revenue side, access, throughput. We've got teams working in our OR and endoscopy. We're looking under the hood on revenue cycle, and then with the strategic plan, where can we grow? We lose commercial patients to our colleagues in Boston, 80% to Boston, 20% to Hartford. So it's interesting. You can get to Hartford quicker than Boston, but our patients, if they can't get in here, would prefer to go to Boston. So we've got to make sure, heart and vascular, neurosciences, oncology, people with commercial insurance, those high value cases stay here, because that's going to support those government payers. And then we're looking at expenses. So having the right number of managers, not too many, not too few. We're doing some work in corporate overhead, right, that doesn't generate revenue. looking at the must-have versus nice-to-have and external spend, supply chain, purchase services. So I like to tell the organization we're literally turning over every stone and being disciplined. And you've got to be on your, in Massachusetts, you have to be on your game every day. Otherwise, you're going to face financial challenges.
Yeah, and we're certainly proud of our academic medical institutions, both in the West and the East, but we want people getting care close to home, right? We want them getting the services that they need right in their neighborhood, and you provide it. You mentioned insurance, and I know there was some breaking news yesterday. It looks like Health New England is going to be staying with Baystate. Is that an opportunity for you? And I know you may not be able to say much, but is there anything you can share about that?
I think we're going to use it as a great opportunity. So as we talk about value-based care, our decision to sell it was an interesting one, right? Because most health systems are trying to get into the health plan business, right? And some start their own health plan and then lose their shirts and abandon ship. But if you look at some of the more successful systems out there, Intermountain or Presbyterian in New Mexico or Corewell in Michigan, they've had a health plan for a long time. They've integrated it. They've developed value-based propositions, and they figured out you can't, organizations like ours that we're trying to make money on our physician group, our hospital, our health plan. That doesn't work. You've got to figure out, like Intermountain, they decided, and they've gone back and forth, but right now, they're trying to make money on their health plan, and they use the hospitals and their physician network to enable the health plan and the members of the health plan. So I think we've got that unique opportunity. So we're going to be spending the next 4 weeks coming back to our board in February and saying, here's what we think is the path forward for Health New England and Baystate being integrated. And then we'll take another 4 weeks and build that out a little bit more. So I do think it's a unique opportunity. It's an opportunity for us to pause and say what's going on with Health New England and our health system and plot a path forward. So I'm excited about it.
Good. Yeah, I think it's exciting. I mean, we look at hospitals seem to be under assault both here and around the country, and you look at the largest national insurer, and their profit margin was double the entire commercial spend in Massachusetts.
Yeah.
Yet sometimes the fingers are pointed our way, and we're the ones just kind of delivering care and save lives. So you get to the community, you're trying to get to know the organization, the workforce, the board. How do you get to know the community? What's been your approach to kind of getting in and around and becoming a little bit retail in the city?
Yeah, I got kind of the wake up call was before I'd even started, was in the Big Y with my wife, and heard people commenting about Baystate, not in a great way. So I was like, all right, let's go.
Yeah.
But one of the phrases I use is the right thing in the wrong context is the wrong thing, always the wrong thing. So when I got here, it's like, oh, you got your playbook. I was like, yeah, just because something worked in Arkansas or New Jersey or Colorado doesn't mean it works here. And so as you articulated, we have a unique culture in Massachusetts, and even Western Mass has a unique culture. So I spent 100 days listening. It was really hard for a type A not to do anything. And one of the board members, I think at day 90, I made a change, and he's like, you didn't last 100 days. I was like, I didn't think I would either. But just listening. So meeting with community folks, legislators, physicians, staff, touring facilities, board members, and while it was 100 days, I think by week 3, the themes emerged. And so I was really pressure testing, hey, what's going on? And the analogy I've been doing this a long time. So I've got a great close friend who does color commentary for Notre Dame radio. So if you listen to Notre Dame football on radio, Ryan Harris, close friend. And you had asked me how I felt about the game. So an hour or two before the game, I always text Ryan, what's going to be the score? And he's never been wrong on who's won, never. And he's always within 7 points of either team's score. And I'm like, how do you do that? He's like, I've been playing football since I'm 5. He was a Super Bowl champion with the Broncos. He has some cool Patriots stories too. But he's like, this is all I know. I can walk on the field and I can see how they come out of the tunnel, and I can see how they're warming up, and I can see how the coaches are feeling. And he's been right this whole college football playoff. And it feels that way in healthcare for me. I can walk around a hospital or a physician clinic and get a pretty good sense of what's going on by looking at the small things and and some of the big things. Do people smile in the hallway? Does the food look good? Do we have nicks in the walls or the door jams or on the doors? So are we paying attention to the details and then just talking to folks? So had a pretty good sense at 30 days. And so I came back to the board at the 100-day mark and said, here's what I'm hearing. And it's, it's always interesting because I would say, I'm repeating back what you told me. It's not like I made this stuff up. And then here are the things that are emerging in terms of priorities. And, now I think as of early January, 7 months, I went back to the board yesterday in our board meeting and I said, all right, we need to tweak some of my observations. Here's what I got wrong, or here's where the hill's a little steeper. Here's where it's easier. Here's where we've got opportunities. So listening's important, watching, and the more you work in the business, I mean, it's like you on Capitol Hill. You could walk through the hallways and you're going to know immediately what's going on and where the wind's blowing, just because you grew up in that.
Yeah, I haven't read right as much as Ryan, unfortunately, but that's okay. We keep trying.
And
I
I'm
love the
not a
big why
better
story.
and I'm not a better either, so I
Yeah.
never bet on it.
I like the big why story. Maybe the next CEO of a hospital around the country is in line with you at Big Y. I love that you can hold on to that because it's worked out for you a couple of times. We're getting to the end here. I want to just jump through a couple things quickly, but I'm excited for the future. I do think there's a transformational opportunity. Are there 2 or 3 things about the future of care delivery that excite you that we should be thinking about or you're trying to do?
Investing in people and community, right? So as the community goes, so go we. So we're making sure that we're interconnected. So, as we think about policy issues, housing's important to us, affordability, taxes, all those things should be on our radar, not just the healthcare things that are out there. I'm excited about it. I think if systems can start to solve access, that's a winning proposition. For me here, helping us find our way again, right? So, for folks that have been here a long time, there were the glory days when we couldn't print money or spend it fast enough. And so we've got an opportunity to reclaim those glory days. They probably weren't as great as we thought they were at the time, or I think of them now, but rekindle that spirit here. And then I just think there's a lot of opportunities for partnerships and scale and especially now around Health New England, having other providers involved in that opportunity would be kind of cool too. So more unique partnerships would be great.
Good stuff. And hopefully you get there and then we get there collectively. Lightning round.
Yeah.
Have you found a must visit spot yet in the Springfield area?
Basketball Hall of Fame, must do it. I would say, and I think my wife's on this, she shouldn't be listening. The White Hut for a hamburger.
Oh yeah, of course. Yeah, one of the best. Yeah, my first visit to Western Mass Hospital, they took me to the White Hut.
Yeah.
Movie.
Goodwill. Yeah, I'm not just sucking up. Goodwill Hunting.
Yeah.
I won't say hi. I won't say why. My wife knows why. There's someone in the movie that that I'm attracted to or was attracted to, but yeah, great movie.
Yeah, it's certainly one of the best. You share a meal with a notable Notre Dame alum, dead or alive. Who are you going to dinner with?
Father Theodore had Ted Hesburgh, right? So advisor, I think, to 5 presidents. I met him the first week I was at school. I was walking to the library with my roommate and someone says, hey, I want to chat with you. And we turn around, it was like the legend. And this is like a CEO moment. He goes, you've been here a week. What's working well and what's not working well, right? So I think that's an advice for any CEO is, when you've got somebody new in the organization or old, just have a conversation. But his impact on the civil rights movement, we've got Dr. Martin Luther King Day on Monday. His impact across not just education in this country was awesome. So having a dinner with Father Ted would be awesome.
Yeah, that's a good story. Thanks. We bookended with your mentor there, and then somebody who's obviously done some amazing things in Father Ted. Last word goes to you. A lot of emerging leaders on the call. 30 seconds or less, what's some advice you give some of our young healthcare leaders that are moving up in the field?
Pick the right boss. We get stuck on, hey, what's my title? What's my pay? What's the organization? Find someone like Sister Marie DePazzi that's going to take interest in you and be there to support you. That's the most important thing. And I would also say pick the right spouse or significant other. This is a tough business. It's 24/7, 365. You're always on. And making sure you've got someone with you at home that can support you and understands that you may not be there for all the kids' things. You may there's some sacrifices, but they're with you in the journey.
Peter, thanks. Good stuff. I feel like we could do this all day. I want to wish you luck on Monday night. Hopefully it goes your way. I'm sure an hour before the game, you'll text and you'll know what the outcome is going to be. But I thank you for joining us, and thanks for picking the right bosses here in Massachusetts and joining us and bringing your leadership to Western Mass and being part of the mission to improve Massachusetts healthcare. I know you've gotten to know our provider community and your colleagues well over the past 6 months, but no, we're always here to collaborate and help as you take Baystate to new heights. It was a treat to getting to know you a little bit more this morning and hear your perspective, your past, and your vision for the future. So thanks for making the time. And to our attendees, thanks for all you do on behalf of our patients, our healthcare workers, and our communities. We've got some big challenges ahead in 2025, but also some exciting opportunities. And I know that with your leadership, your help, your support, your engagement, we will take healthcare in Massachusetts to the next level and build a better system for all the patients that we serve. Hope to see you at our 88th annual meeting in just 15 days at the Western Seaport in Boston. It's our premier event for the healthcare community each year, where leaders, policymakers, influencers convene under one roof to discuss the topics of the day. Governor Healy will join us again for her annual healthcare address. We'll also hear from our healthcare CEOs, insurance executives, and a range of other voices who are shaping our sector in Massachusetts. You can learn more or register at mhalink.org. Thanks again for joining us for a morning coffee and another great conversation with one of our extraordinary leaders. And Peter, thanks so much and look forward to seeing you again soon. Have a great.
Thanks, Steve.